These are the tools that you are talking about, the HISs, EMRs, APRs, the financial modules in the systems, the ERPs and everything. All these tools needs to go to work with each other to create a capacity, to create a cognitive capacity. And what is this cognitive capacity? Is working in a proactive way than a reactive way. Right now, our systems, most of them, not all of them, but based on the needs and the requirements of the healthcare centers and hospitals, they are reacting to the data. They are receiving data and they are reacting to the data. And yesterday in some of the panels, one of our dear colleagues was talking about their own point of view and saying that it seems that physicians and the clinicians, they are treating data, not the patient. And this is the point, because when we are pushing our clinicians to look into the data and to screen and monitor the data, of course, they will treat the data and they will to make sure that these data is aligned with the patient situation and with the patient improvement, health improvement. But the new advanced technologies that are going to be applied on the top of our HISs, these are going to work in a proactive way. These are going to be accountable, transparent, and remove or mitigate the biases. For me, these three basic things, this is the foundation of implementing the new technology, the advanced technologies like AI that is a hot topic these days and everybody is talking about, to have systems that functionally works. And for me, the future of HISs, the future of EHR is a learning system. Yesterday I was participating in a panel and I received a great question to talk about the smart hospital, and I said that a smart hospital for me is not just only a connected system, but also is a system that is agentic and responsive, which is the main theme of this conversation right now. And I said that a smart hospital is a living, learning node within a health ecosystem. So the future hospitals, the future solution, HISs and EHRs, are not just solutions to get data and to observe and show data either in the analytics layer, or either in the dashboards, or either in the patient treatment or the patient summary or electronic medical records. But the future hospitals are those and the future solutions are those solutions and the centers that take care of the people and process as well as the data. So they know, and they know that the people as well as the data, these two are creating data together. So it's not just about the devices, the point of care devices who are creating the data, but also the clinicians, the people that are taking a look into that data and they are creating the data. And then based on all these three together, the insights are shaping and creating, and the improvements or enhancement opportunities are suggested. So the advanced technology layers like AI are going to act like this. They are going to discover the data, sense the data, understand the data that are coming from the people, the process, and the point of care devices and the different type of solutions, and then they are going to act by following a set of rules that are validated and approved, of course, by the clinicians to improve the whole healthcare ecosystems and to keep the healthcare center and the solutions there. When I'm talking about the healthcare center, I mean the solution plus the people as a living node that learns from its own operation and then helps the whole ecosystem to improve and to grow. And this is the architecture, the basic architecture that I'm thinking about. Data foundation is a base, and then the integration and interoperability at the same time. And when I'm talking about the integration and interoperability, I'm not talking about connecting one device or one third-party system to another system, but I'm talking about having interrelating modules, even within one system, that works and shapes, that works together to shape the data, to regulate and to validate the data. And then the intelligence and analytics. Analytics is something that we are already now experiencing, and we are already now utilizing in our healthcare centers. But intelligence is something different, and intelligence is not just technical, but it's also about the organizational alignment and human empowerment. So by having these two words, organizational alignment and human empowerment, I'm again mentioning in a different way how much taking care of the people, the process, and the data inside the hospital is important. So this is the end of my conversation, and I hope that you would and you could ask these questions and think about it. Is your hospital or the healthcare center or the society that you're working with is connected, or is it cognizant? Having a cognizant system is the future, but without having a connected system, we cannot walk through that future. Thank you so much. Any questions?